I'm sure you've heard about dissociation around social media, but I'm pretty confident that you've never heard of structural dissociation. Today, I have a guest speaker who's going to give us the lowdown on dissociation and ways to structure interventions that can be helpful. Welcome back to Savvy Psychologist. I'm your host, Dr. Monica Johnson. Every week on this show, I'll help you face life challenges with evidence-based approaches, a sympathetic ear, and zero judgment. I am so happy to have Sasha with us today to talk about structural dissociation. This may be a topic that you haven't heard about before, but I'm sure you've heard about dissociation because it's been something that I've been seeing more and more in the mental health community. So I am so pleased to present our guest today. Sasha, can you please give people an introduction to who you are?
Absolutely. Thank you so much, Monica. Alexandra Mejia. Everybody calls me Sasha. I run a private practice. It's a teaching private practice that specializes working with complex trauma, dissociation, and personality disorders, which, believe it or not, that whole group really does kind of go together hand in hand. I specialize working with structural dissociation as a model to help reintegrate pieces of my client's personality back into a whole.
Yeah. And before we get into the structural dissociation part, can you just give us a general kind of working definition of dissociation as a starting point?
Absolutely. Dissociation is actually a biological tool that we all have, and we all use it depending on the situation. And it can span from something as mundane as daydreaming or highway hypnosis to dissociative identity disorder, where you have these very strong dissociative parts that create memory loss when they're activated. So there's a great spectrum. And in the middle of that spectrum is where a lot of the trauma is, right? Where we might feel like we can't connect with our own bodies, or we feel like things are foggy around us and unreal, or possibly even have pieces of memory missing from our day to day, right? So we might have left our keys somewhere and then they show up somewhere else and we're like, when did I move them? Type of thing.
How does structural dissociation start to relate to this?
So, structural dissociation occurs when there is a long trauma history or there's a lot of what we call toxic stress throughout childhood and our developmental period. Toxic stress can become complex trauma over time if there's nothing secure in the child's life throughout their childhood. And so, what happens is a toxic stress period occurs and a part of your personality dissociates from you to help you survive that time period. So, if let's say this child's toxic stress is the parents are always fighting, every day they're fighting, fighting, fighting. The dissociative part might have the child numb out so that hearing that doesn't impact them as much, right? So that numbness is actually a part trying to protect that child that then later in life snowballs into something that is very dysregulating or not helpful in adulthood.
Right. And with the dissociated part, what should they be looking for? Should it be something like numbness if someone was trying to like figure out if they had dissociated parts?
So there's in the structural dissociation model, there's five different types of parts that you can keep an eye out for. But the general sense is that when triggering happens, there's a switch that's kind of flipped in you. So you'll go from 0 to 60 or 60 to 0, just like right away. So you might be in a situation, you're out with a friend, and the friend says something that is innocuous to anybody else, but for you, it might trigger a neural network in your brain that's traumatic,
Hmm.
taking you back to that time period. And all of a sudden, you're in tears. You're in tears, and maybe you're speaking with a baby voice. And you're like, I don't know why you said that. So it's very evident. It's like a very switchy type of thing that happens. And I see this happen in sessions a lot where a client will come in and they'll be themselves. And then all of a sudden I ask a particular question and they're just like, why would you ask me that? Like really like intense, like just almost like a different person is in front of me. For people that are trying to identify this in themselves, it's sometimes hard because they might not see themselves. So it's good to ask people around you, do you ever see this in me?
And when you say see this in me, kind of that personality switch that you're talking about, or kind of like the emotional lability of going from like the 0 to 60 or 60 to 0?
Yeah, so it's almost like during a conversation when I get upset, does it kind of seem like I'm a different person?
Sure, yeah. You alluded to there being kind of 5 different, categories. Can you say more about those?
So they're all based on trauma responses or fight flight responses type of things, right? So we have the fight parts, which are combative either to ourselves or to others. So these parts might say things like they're trying to hurt you, or they're out to get you, or I'm bad, or I should be ashamed of myself. I'm wrong. It's all because of me, right? So these are kind of the fight parts. Then there are flight parts, which can be those parts that might possibly dissociate to get away from situations. They might be suicidal because they're trying to get away from all their problems, right? Running away, hiding, things of that nature, those kinds of behaviors. Then we have freeze parts. These are the parts that make us just quiet, silent. A lot of dissociative features here as well, in terms of you just kind of freeze up like a deer in the headlights, right? Your boss comes into your office and you're all of a sudden just like, I can't explain myself type of thing. Lots of F's. Then we have the submit parts, which are those people pleasers, right? So we're submitting to protect ourselves. So if it's a child, they might just do whatever to not get in trouble or not get hit or not get yelled at. The submit part might come home and do all of the cleaning and anything they could think of just to make sure they don't get yelled at. Right. Their mom comes home. Oh, look, I did all of this and all of that. What do you need me to do something else type of thing? Right. And then we have the cry for help parts. These are the most vulnerable parts. They're usually very young parts. And the behaviors are crying, reaching out, overly being concerned about people not liking them, things of that nature.
Mhm. And with these different parts, because they're aligned with survival responses, I'm assuming that a person may not see themselves in all 5 of the categories, that there may be like 1 or 2 that they're more strongly aligned with.
It's possible, yes. And on the flip side, it's also possible that they'll have multiple parts in some of the categories. I've had clients with 3 fight parts, 2 submit parts, right? A freeze part, and so on and so forth. So there's really no limitation of how these parts can present. It really depends on the amount of toxic stress and complex trauma that they've experienced.
Are there, I know you've mentioned trauma and also like personality disorders. Are there any other diagnoses that you normally see as it relates to structural dissociation?
Depersonalization, derealization
Mm.
disorder fits into this. Dissociative fugue, dissociative identity disorder, what we know as DDNOS, which is dissociative disorder not otherwise specified. So, all of these dissociative disorders tend to be in the realm of structural dissociation. A lot of the times they present without PTSD symptoms. Another thing is they're often confused with psychotic disorders because there's a lot of internal talk that sounds different from the person themselves.
Well, I'm assuming if you have a highly critical voice inside your head, it may sound different from you or may be someone's voice that you recognize that maybe you that represents that critical voice.
Oh, yeah, absolutely. I've had a lot of clients who are like, "Oh, yeah, that's my mom's voice in my head, or my sister's voice in my head, or my dad's voice." Yeah. Or like an ex, even if the trauma came from like a prior romantic relationship.
So, if I have an awareness that I have these parts, because I know you mentioned like, you may have a patient with like 3 fight parts and 2 submit parts. Is the goal just to amputate all of these parts and get rid of them?
No, no, it's actually the opposite. The goal is to reintegrate the parts to create a sense of wholeness within you. And that's not as easy as it sounds, probably, right?
Oh, it
Because
sounds pretty
we're
hard. So,
because 'cause you're not just working with the whole, right? A lot of times you go to therapy and you're working on your whole self, right? To heal you from depression or anxiety, right? But here, you're possibly working with 5, 10, 15, 20 different clients, and you're trying to integrate them all into the one client that's in front of you, if that makes sense.
yeah. How does the person I don't know a difference between like the part and the whole? Is there a way for them to tap into that?
Absolutely, and, you can use language from different, like, therapeutic modalities, right? You can use DBT language saying, "When you're in wise mind, that is your true self being presented." You can use trauma language saying, being in the window of tolerance, right? That's your true self. Because when our parts are triggered, we're either going into like the sympathetic fight flight or into the parasympathetic shutdown mode, right? So we're going to be outside of that window of tolerance or the wise mind state. Or if we're talking about mentalization language, we're mentalizing effectively, right? We're in an effective mentalization state. So and depending on what language you want to use or how you want to look at it, it is the idea of feeling grounded, present in the moment, and being able to feel your emotions and rationalize at the same time. See all different angles of the story, different perspectives rather than just kind of a one track mind.
You've spoken to a couple times that and you brought up the language of the window of tolerance specifically, and you've described kind of hyperarousal versus like hypoarousal. Do you have any suggestions for either one of those extremes?
Absolutely. I mean, any grounding skills from any modality you want to, pull from DBT or ODBT are really good for either of these, right? So when we're grounding ourselves, we're literally just feeling our feet on the ground or touching something. We're connecting with something that's real in the world so that we can bring ourselves into that window of tolerance again, calm our emotions or increase our energy so that we can be present again. And so the basic grounding exercise would be to just plant your feet on the ground, whether you're sitting or standing, if you feel comfortable closing your eyes and just focusing on the sensations of the bottoms of your feet, the tops of your feet, noticing anything wrapping the feet, and just engaging with those sensations so you come back into your body and back into the present moment.
I'm going to assume that a lot of people maybe struggle with like meditation, like or grounding. Would you suggest anything like as a starting place for them? Cuz sometimes it can be, difficult especially for longer spans of time to do this sort of thing or maybe you're confused even on just how to do it. Like, in terms of are there groups that you would suggest or YouTube channels or anything that could maybe be an extra tool?
Yeah, absolutely. There's so many mindfulness groups out there. My own practice is starting a therapeutic sangha, which is a meditation community that helps you kind of practice more regularly and connect with others who are practicing. YouTube have so many videos from really like brief videos that just help you learn to follow your own breath to, just reaching out to a therapist who does mindfulness work and having them train you in sessions.
Yeah, I like what you said about the Sangha because so many patients describe feeling like alone in their situation. So, having a group setting where you can know that maybe people have similar experiences as you and you're learning the same sorts of things and can be hopefully vulnerable together and like grow together sounds like it can be a healing experience on multiple levels.
Yeah, it absolutely can. I mean, community nowadays is so hard to find sometimes, especially honestly, especially in big cities. You'd think there'd be so much community in big cities, but everybody's like out for themselves and their own nowadays, and it's hard. It is hard.
Any things related to hyperarousal that you would suggest? Because I know that when I go back and I'm telling people about structural dissociation and we talk about the hyperarousal, some people get so flooded and overwhelmed that the numb side of things can feel like a relief to just like not be able to feel. But when you're fully hit with that full impact of emotion, it can really drive people into the ground, so to speak.
Yeah, and this is really up to the therapist to lead the sessions in an effective way. It's not recommended to just straight jump into structural dissociation or any type of trauma work right off the bat, right? You're done with intake, let's do trauma work. Like that doesn't work. You have to learn the meditations, the coping skills, the relaxation skills, the breathing skills. All of that needs to be done prior to starting this work because it is so easy to get triggered. I've had clients start bawling and having panic attacks during intake, just briefly being exposed to a traumatic memory. Imagine just jumping in there right away. That's only gonna re-traumatize the person, and that's also why it's possible to do this kind of work for yourself as, like, a self-help thing, but it's not recommended because you're not gonna know when you're necessarily ready to move on to that work. Are you gonna have motivation to practice all of these skills and know when you're like, "Yeah, I have enough skills to go and do this and not re-traumatize myself," if that makes sense?
Well, and what you said about being ready is like a curious thing because sometimes people will say like being ready means that I'm not triggered by my trauma, so I'm ready to approach the trauma. And I'm kind of like, wait, that's not really how that works or what that means. Being ready may just mean that I have the necessary kind of spaciousness, so capacity that I've built up with my therapist to be able to approach this and use skills when I do feel myself starting to get triggered.
Yeah, and it's important to reiterate that triggering can be dissociative, not energizing, right? So, like, triggering can shut you down. And you can feel so triggered that you are always shut down and don't even realize it, right? I have several clients I'm working with that are in session kind of just like very numbed out, never cried a day in our working career together, never really they're talking about their friend being murdered as though it's what they had for lunch yesterday, and that's not readiness, that's numbness, right? That's dissociation in and of itself.
For sure. You've talked about like the skill of the therapist, and part of what I'm picking up on what you're saying is you need a therapist with a high level of skill and understanding of these things. But I'm also picking up that this can be longer term work. This is maybe not something you're going to show up for 3 months and then we're done.
Yeah, and this is this is something that you might be doing post EMDR even, right? Like you'll work through EMDR to really process some of that memory, but the structural dissociation might still be present. So you might continue that work into your structural dissociation to really bring everything together.
I mean, one of the reasons, why I am an integrated therapist is exactly what you've been talking about is that you kind of have to be a Swiss Army knife so that you can tailor the experience to the person that you're working with. And so sometimes if we are a therapist that's trained in one modality, we tend to lean into that one, and we may kind of start to have a one size fits all approach sometimes with things that are a lot more complicated and nuanced. I have certain modalities that like basically they're in everything like that I do. Foundational, I would say DBT is like that for me. But then, it may be DBT and EMDR and IFS for this person over here. It may be DBT and cognitive processing therapy or prolonged exposure for this person over here, like based on their traumatic experiences, their PTSD, their symptomatology that is showing up. You really have to tailor it to what you see coming up in real time.
Absolutely. I agree 100%. And my practice also kind of structures within DBT and mentalization and then builds around it depending on the client's needs. And with dissociative clients, and that's whether they have trauma, like PTSD type trauma, whether they have personality disorders with dissociative features, there has to be a baseline that we start with because again, we're not going to go into the trauma work right away. So what do we do first? We build the baseline for the client to stand on their own 2 feet when they're exploring the trauma in whatever method we choose to.
I really want to ask, like, if people are looking to do this kind of work, where can they find you? You mentioned the Sangha. It sounds like you're also seeing individual patients. Please give us all of the information.
Sure. Yeah. I have a website, Mindful Insights MHC, as in mental health counseling.com. It's a group practice, it's a teaching practice. All of my clinicians are trained in DBT and RODBT and mentalization. Those are our groundwork, right? As well as structural dissociation and sensory motor psychotherapy. So this is like the integrative work that we do as a staple. Our clinical residents, who are the students that we work with, offer lower fee sessions for people who are uninsured or underinsured or have high deductibles or whatever. And then I have a couple of other clinicians that work with me, also all trained in these modalities. You can find us on Facebook as Mindfulness with Sasha, on Instagram as Mindful Sasha. And yeah, I don't know if I missed anything yet. Oh, we're also now offering ketamine assisted psychotherapy via myself. I am offering that in group format as well as individually. I'm available to do it in person in Connecticut because that is where I am based. But I'm also offering it virtually in New York, Vermont, Delaware, and Florida.
I just want to say thank you so much for sharing your expertise with us. I'm sure there are some listeners that are going to resonate with what you are talking about today and now know that their experience is not strange, that they are struggling with dissociated parts, and it would be very helpful for them to potentially seek services from someone like you. And just so that everyone knows, because we're using terms like mentalization based therapy and like sensory motor psychotherapy. These are all different types of evidence based practices for trauma that hit trauma at the cognitive level, the behavioral level, and also somatic therapies, everything across the board. And I think that's when we talk about being integrated, being able to have treatments that can meet a person where they're at makes a huge difference.
And I just want to add on for all the folks listening that are relating to this, there's nothing wrong with you, right? Dissociation is a normal part of everybody's experience. Surgeons dissociate during their surgeries so that they can get through their surgeries. Athletes dissociate when they're doing their peak performance. Musicians dissociate on stage to just, keep it moving and focus. So there's nothing wrong with you. Your brain bodies are doing exactly what they were built to do. And stigma around it can be quite painful and often prevents people from seeking help. So I just wanted to add that in there as
Oh,
well.
for sure. I'm always talking to patients about the idea of within normal limits. It's like everybody dissociates, and when it's within normal limits,
Mhm.
it's not an issue. You're here because it's outside of normal limits, and it's getting in the way of you being your full self and having the experience of life that you want to have.
Yeah, absolutely.
Again, thank you so much. I enjoyed this conversation. And everyone, please whether you choose to visit the practice or visit the Instagram, please hit up one of those links and get some more information about structural dissociation.
Thank you so much, Monica.
Thank you so much for listening to this interview. If you have any questions or comments, you can reach out to me via Instagram at KindMindPsych, or you can reach out to Savvy Psych via the email at psychologist@quickanddirtytips.com. The Savvy Psychologist is a Quick and Dirty Tips podcast. It's audio engineered by Steve Rickyberg. The director of podcasts is Holly Hutchings. Our podcast and advertising operations specialist is Morgan Christensen. Rebecca Sebastian is our marketing manager, and Nathaniel Hoops is our marketing contractor. Follow Savvy Psychologist on Apple Podcasts, Spotify, or wherever you listen to podcasts. That's all for this episode of Savvy Psychologist. Thanks for listening.